Hello, I'm your host, Angela Marciano, and I've created this series of interviews to inspire hope and connect you with some amazing women's health and wellness professionals. Because we've all seen women struggle, often for years, with shame and overwhelm, or give up hope of ever feeling good or normal or whole again, or decide maybe they really are just weak, or it's all in their minds like they've been told, when really the solution they needed was out there. They just didn't know about it. I hope this helps.
Hello and welcome. For those of you that don't know me, I'm Angela from Angela Marciano Physical Therapy, and I'm so excited to have my friend Blair Evanosky. Did I say that right, Blair? I'm never quite sure.
Good. Yeah.
Yeah. And she is from Pregnancy and Postpartum Physical Therapy in Westford, Mass. How did we even meet? Did we meet on Facebook? Are you like a
I think
real
so.
OG Facebook friend?
I think
Yeah,
yes.
that's
A little
awesome.
while.
um, so tell us a little bit about your practice for those of us who don't know you.
Yeah. So I'm in Westford, Mass, like you had mentioned, and I focus mainly on pregnant and postpartum women. I like to remind everyone that postpartum is forever. So that
Mhm.
doesn't mean you have to be brand new postpartum. And I'm a pelvic floor and orthopedic specialist. So I do see people for either or. But most of my patients are pain due to pregnancy or postpartum pelvic floor or orthopedic issues.
And it's amazing. We were talking a little bit about this the other day, how we it's not uncommon when you work with postpartum women that it's, when did your back pain start? When my son was born. When was your son born? He's 15 years old.
Right.
We'd love for moms to get in sooner, but a lot of times it's hard and sometimes they don't even know about us,
Right.
right?
Would be hard to find.
Mhm.
So find us, yes, then they're coming. And then the time, it's a commitment to
Yeah.
get yourself there.
Yep.
And so I tend to see the kindergarten age moms a lot. Like my
Yes.
to kindergarten, I have a minute to breathe, not more than a minute, but
Right.
a minute to breathe, and here I am. Help me.
Yeah, definitely. Definitely. I agree. But and the important thing is like it's never too late. Like you can go when
Never
your
too
kids are
late.
in kindergarten, you can go when the youngest is in school, and quite frankly, you can go when the youngest is in college, but we'd
Hmm.
really rather see you not suffer so long. But I know we were
Right.
talking about I've had great results with people like fairly quick sometimes, depending on what's going on, even if it's been a really, really long time. There's a
Yep.
huge range. Yeah. There's always hope, which is awesome. And how did you know you wanted to be a physical therapist?
Yeah. When I was 14, I guess, I wanted to be a math teacher, which would have been awful. I was one of those kids who like knew the answer to the math question, but not how to get there. I would have been a teacher. So luckily, I tore my ACL and ended up in physical therapy. And I was like, hey, this is pretty cool. And then decided to tear my ACL again. And I was like, I really like physical therapy. Um, so then I tore my ACL again. And they were like, hey, do you want a job here? And I was like, yeah, I would love to. So I was the aide at a PT clinic for the end of high school into college. I got into college and I tore my ACL on the opposite knee for like one last go. And really, that's when I had to make the decision to stop playing sports. And really, my physical therapist was the one who's really there for me. Really, we have time with people,
Yeah.
so no one wants me. You have to stop because I
Yeah.
could have, but is this really the best idea for your body?
Right.
For the rest of to have this maybe happen again or to keep playing through this. And of course, it was a tougher recovery. My fourth one in 5 years, and I needed a break, and it was really my physical therapist who was there for me mentally. Like the mental
Yeah.
support I got there was great.
That's
And that
awesome.
really, I mean, I was already in school for PT at that point, or for exercise physiology for the undergrad degree that I needed, but
Yeah.
it really set in place that like that's what I want to do. I want to go help people like they helped me.
Mhm, mhm. And it is huge. Like there's definitely there's that physical piece and like here are some exercises, we're going to work on you, we're going to teach you some stuff. But there is a lot of really kind of coaching someone along involved, whether it's getting through anyone who's been through an ACL reconstruction, like it's a slow process.
Right.
Whether it's just coaching them through that or like, yeah, 4 times in 5 years. Ooh, I didn't
Yeah.
realize they were that close together. Oh
Yeah.
my
I do recommend if you're going to tear your ACL, like when you're a teenager is a lot better because, you know, you don't have a whole lot else going on besides heal so that you can play again.
Yes.
But yeah, it was just a lot on my body. And I didn't recover from the last one as well as I did the first one, of course.
Yeah.
And I needed a break and I needed way more rehab than
Yeah.
the 6 months that seems like a lot.
Yeah.
I needed that, you know,
Wow.
so
And
luckily I had supportive people who
yeah,
said, take a little break.
yeah, for sure.
Yeah.
Now, where did you go to PT school?
I went to undergrad at UMass Lowell and
Yep.
then I went to Franklin Pierce for grad school in New Hampshire.
Nice. And what was your first job coming out of school? Your first job was long.
I did. So I am just like a long employee. So I worked at that first clinic that I told you about from the time I was 17 until I was 24 and in grad school. And then when I graduated in the end of grad school, I left that job and I took another job at a
Yeah.
similar type place, a big outpatient clinic. So it was a chain, but my place was small. So there was 2 therapists there. It was mainly outpatient ortho, you know, your traditional post-ops. It was very busy. I saw a lot of patients per day and I was there for almost 10 years.
A long time. Yeah.
A long time. Yep.
Yeah.
And so I started my women's health journey there. I had an awesome mentor down the road who owned an out of network practice and we would share patients and she taught me so much. And I realized that I wanted to incorporate more and more and more of it. So I started their women's health program. And then I came out on my own.
Wow. And we were also talking, you've got two little ones or one.
I have a 4.5-year-old girl and a 3-year-old boy.
Yeah. And so you had your own experience too, right? After your pregnancy. Was it your first pregnancy or your second?
So I had some interesting experiences after both.
Yeah.
But after my first, I went to my new friend, my pelvic floor therapist down the road. I'd had a C-section and I knew I was supposed to go. I didn't have a whole lot of symptoms, but I was like, here I am, you
Yeah.
know, I'm
And so
supposed to.
your OB or midwife didn't necessarily say, here's a referral for PT, right? Which is one of
So
the things we're trying to work on is like really ideally everyone should go at least a visit or two, like just check in some tips, some pointers. But the average
yes.
person doesn't know that. So you just marched yourself over there, right? Set up your appointment.
Yeah. So I actually needed a referral from my
Mm,
doctor, I
okay.
thought, because she took a little bit of insurance, out of network
Yeah.
insurance. So I thought I needed one. And so I said to the OB on my 6-week appointment, I said, oh, I'd like a script for PT. And he said, you just told me you weren't leaking urine. And I said, no, I'm not. And he said, then you don't need a script for PT.
Hmm.
And I just felt so awful because I know the courage it takes some people to speak up and say, hey, I want this. And then I was shut down.
Yeah.
And at such a critical point in your life,
Yeah.
I'm fortunate that I have the knowledge that I had. And I spoke up for myself and I said, no, that's not the only reason you go to pelvic floor PT. And he reminded me that I had a C-section and I reminded him that was major surgery and that I needed to go to PT. And so he wrote me a script and on the diagnosis, it said self-referral.
Yeah. So right, you had the wherewithal to push for yourself. Well, I know like
Yep.
I had C-sections, but I felt pretty good after physically. But I was older when I had my kids, so I was having a lot of anxiety, but I really liked my OB. He was really, really nice. So when I went in for my follow-up, he was like, "How are you?" And I was like, "I am great. How are you?" And it wasn't until and with my second one, I had the same thing. It wasn't until that second one, like I was really struggling and I just didn't want to say anything. Never mind
Right.
if I had said anything and he sort of shot me down, right? And it happens, unfortunately. It's not uncommon. So really there's I guess that would probably be one thing I would want moms to know, right? And probably you too,
Yep.
like, don't be afraid to ask for a referral and
Right.
don't be afraid to push if it's not handed over and
And don't be
don't
afraid
be
to call
afraid to
us.
find a new doctor. Yeah, yeah,
Yeah.
yeah,
You
yeah,
know, we're lucky in the state of Mass that we don't actually need a referral.
right.
Some insurance is required if you're going to get reimbursed through your
Yeah,
insurance, but we can help. Like you can get
yeah,
it through your primary care. we can send over an order. Like, I'm happy to help my patients find that script if they need it. If you know you need pelvic floor PT, find a pelvic floor PT and they will help you.
Mhm. You
We
don't
all
have
want
to be having severe symptoms. Like you don't have to be having huge prolapse symptoms of pain and pressure with standing or incontinence or pain with intercourse. Like just postpartum, it's just great to get in and just get a few pointers and just make sure
right.
things are where they should be or how they should be. Yeah.
Yep.
Yeah.
I think I'm a prime example of that. I told you I felt really good. I went because I was like sort of supposed to. I know that
Mhm.
we're PTs. We know like things aren't great. I just had a C-section, and I was expecting her to say, "Yeah, my abs were weak, and I had
Yeah.
trouble initiating low abs." And what she told me was that I had a pretty significant prolapse,
Yeah.
and it was surprising. Um, but also it's good information to have. Yes, it's scary. The first couple times thinking about it was not my favorite,
Mhm.
but overall it's something that you want to know about your body so that you
Mhm.
can do things to help, right? And we know that lots of women have no symptoms of prolapse but still
Yeah.
have prolapse.
What would you for someone who doesn't know what a prolapse is, what's your
Yeah.
little nutshell?
So prolapse is a descent of one or more pelvic organs. So in your pelvis, you have organs. The major ones that we talk about are your bladder, your uterus, and your rectum. And they can move. And my favorite analogy is just like boobs. Your boobs don't sit where they used to before you had kids, and it's no big deal. And
That's a
your
great
organs probably
analogy.
sit where they used to either, and hopefully it's no big deal. Severe prolapse can be a surgical need, but a lot of times the more mild prolapse, working with a physical therapist and thinking about some new strategies can be really, really helpful.
Yeah. Yeah. And how about symptoms, prolapse symptoms? What are some things someone might be experiencing if they had prolapse that was symptomatic?
Yeah, so the major things we see are people complaining of pressure or heaviness, something falling out of the vagina or feeling like something is in, like a tampon is in when it isn't,
Hmm.
pain, urinary or fecal incontinence,
Hmm.
feeling the need to help a bowel movement come out by using your hand on your perineum, feeling like you
Hmm.
need to support your perineum to have a bowel movement.
Hmm.
Those are some of the main
The
ones that I
common.
hear.
Yeah. Yeah.
Yeah.
And so you had none of those symptoms, but still significant for you to know, right? Because
Yeah.
it's going to impact. Can you talk to people about that? Like how did that impact like what you chose to do or not do after your
Yeah. So
pregnancy?
just in general, working with a PT to decide when to get back to higher level activity is a great idea, even if they find no
Yeah.
prolapse, no diet, nothing really going on. It's still helpful. They can tell you when you're strong enough to use your pelvis well and just be smart about the choices you're making. But for me, it really impacted when I would return to impact exercises
Mhm.
and when I would return to heavy lifting.
Yeah.
So if you look at Dr. Google, sometimes Dr. Google will say, don't return to those activities. And I
Yes.
really don't agree with that.
Yes.
So prolapse is usually from some loss of ligament support, sort of like a sprained ankle. And we would not tell a sprained ankle to never use any strengthening exercises
Right.
from their ankle. Like, you need them. But you need to learn how to do them well.
Mhm. Mhm.
So working with a PT to work on strategies, work on strengthening so that your muscles are strong enough to do it and you have good strategies where you're not bearing down and putting pressure down onto those organs is really important.
Yeah. Wow. Now
Yeah.
was that all after your first pregnancy, the prolapse and the C-section?
Yep. And then I had
And
a second C-section that didn't want to close after my son, after
did
my
your
second.
did your prolapse improve after your first pregnancy prior to your second? So you still had that grade 3?
The stage did not. So my stage
Yeah.
varies. You
Yes.
can see a stage 3 sometimes, and this is common for most of our clients,
Mhm.
that you can see a stage 3 if I'm tired, if I've been on my feet most of the day, towards the end of the day. Sometimes in the morning, I'll be like a low grade 2,
Yeah.
depending on where I am in my cycle, because your uterus hangs lower during. So I don't have uterine prolapse. I have rectocele, meaning the rectum is pushing into the posterior wall of my vaginal canal. But the uterus being lower still affects that.
Yeah.
So different phases of the cycle, you could see different things. So I'm a 2/3,
Yeah.
and I think that's important to know that they do change. They can
Yeah.
get better.
Yeah.
So we see a lot of people who have whatever the stage they have initially postpartum get half a stage to a stage better with PT.
Mhm.
Mine hasn't significantly changed over time. It definitely didn't get worse with my second pregnancy. And that's pretty true when we look at the research that second pregnancies don't tend to worsen prolapse. It's one of the big fears of my prolapse patients.
Yes.
If you have a medically assisted, like a forceps or vacuum vaginal delivery, it may change your prolapse for the worse. But even a grade 2 tear
Mhm.
vaginal delivery won't usually change that prolapse. So we're trying to take some of the fear away from patients who
And I
are.
think that's really important. Yeah, that fear factor of like, oh my God, because it just seems intuitively, right? Like if you didn't know that for sure, like, oh my gosh, if I push out another baby, go through another pregnancy, this is going to be so
Right.
much worse. That's a huge fear.
Yep.
So that's great. That's great. Yeah. Yeah.
Yeah. Yeah. No change for mine.
Wow. And
Um,
so then your second pregnancy, how did your second pregnancy go? How'd you feel during your second pregnancy?
So I've been fortunate to have two pretty easy pregnancies. My second pregnancy was unplanned, and I didn't know that I was pregnant until I was about 12 weeks pregnant.
Oh my gosh, I did that on
Um,
my first one and it's so much better. It's a 6 months pregnancy. It's great.
it's so much better. Yeah, I didn't have a lot of physical symptoms. I felt pretty good. Um, really no
Yeah.
big complaints.
Yeah. Yeah. And so then you had a C-section the second time as well, and that didn't want to
Yeah.
heal?
Yeah. So I have had trouble in the past with some of my ACL surgeries. One of my scars keloided, meaning it was thick and
Mm.
raised. You just didn't want to heal nicely. So that's a concern. You don't want an abdominal keloid if you can help it, because more scar tissue around organs is not great. So I kept thinking that it was going to heal. Like half of my first, not even half, like a little bit of my first one had keloid. And so they cut it out. So they
Yeah.
cut a bigger section than they would have on a normal C-section.
Yeah.
And when I took the dressing off, like I don't know, a couple days a week after,
Mhm.
one side just really was pretty significantly open. So I went back to the doctor, and they just kept watching it and watching it. And I was fortunate it never got infected, but it took a very long time to heal. And I expected to have some scar issues from that. And I had a thicker scar,
Mhm.
but with working on it and giving it time, it's
Mhm.
done really well. So surprising to me after such a long wait for it to heal that it ended up okay, but it did. It ended up okay.
That's awesome. That's
Yeah.
awesome. And that is pretty scary. Like that's a scary thing where you're like, "Oh my gosh, this isn't healing."
Yeah.
But yeah, give it time.
Hmm. Keep it
Probably
clean.
did you have some we were a little bit more restricted in lifting and stuff for a little bit longer because of that lack of healing?
Yeah. So I am like super fortunate and privileged to be able to say that I had a 17-month-old and a newborn, and I did not pick the 17-month-old up for the full 6 weeks. I had lots of help. I'm very fortunate. Thanks, Mom. Thanks to my
Yeah,
husband.
right?
They rotated through shifts so that somebody was always with me, so that I wasn't. And I had a great 17-month-old who slept like
Yes.
to the exact time she was supposed to sleep till, so someone could just come over in the morning and get her. And I think that really helped, the fact that it did finally heal,
Yes.
because I was more conservative with what I was doing, and I was more careful. I didn't lift overhead until it was healed.
Mhm.
Yeah.
Yeah, that's nice. So it is, it's the stuff that we tell people it's hard, it's inconvenient, it's not always totally manageable.
Right.
People had to make stuff happen for that to happen for you, which is awesome. And you were lucky to have people around who could do that. But it is like we do get how hard it is when we don't say it
Right.
lightly. I guess I would say it's like if your PT tells you really limit the lifting, we only tell you if we really mean it.
And I still tell people, like, I get people, they're coming in, they have the smaller toddler and they're pregnant with the second and they're getting a C-section, or they might end up with a C-section. And I just tell people, like, plan out the time, really try to get someone ahead of time to help.
Mhm.
And then here's how you are going to lift if you have to,
Yeah,
because it's like abstaining from sex, right? Like, that'd be great if all kids abstain from sex, but here's a condom in case, is my philosophy.
right. Yep.
Sort of thing, like, we don't want you to lift,
Mhm.
but if you have to lift, we're going to practice
Here's
so
where
that you do it as safe as you can, and so that we take some of the fear away, because the worst thing I think is going into lifting a child in fear that you're going to hurt yourself, and then you're really, everything's tense and you're not going to maybe do it as well as you could.
Yeah.
So we practice even though I don't want them to have to lift.
Right. But they got to know how, because life happens. Yeah.
Right.
Yeah.
Yeah. The chance of you having someone able to come for 6 weeks and your child listening and sleeping when it's supposed to,
All night long. How nice.
really not, I'm a unicorn.
Yeah. That's awesome though. That must have been awesome. So if you had any advice for postpartum moms, whether they're like postpartum, just got their clearance, or it's been 5 years or 10 years and they're wondering about some stuff, what would any tips for moms?
I mean, get in and see a pelvic floor PT if you can. Even if you can get in for 2 or 3 visits, like it doesn't have to be a ton of visits to make a big impact. You're worth it. You're worth spending the money. You're worth spending the time. It can be really hard, especially adjusting to new mom life, to think like, can I really leave for an hour and a half to go to my PT appointment? Yes, you can. Talk to your PT about it if you're nervous about that. Like maybe you bring baby, we make things work, but you really, really are worth that time and that energy and that money spent to set yourself up for the rest of your life.
And it's not that they need to come in to see you to get fixed, right? It's really so much as the education. I mean, yeah, there's a hands-on component. Sometimes we'll do some manual or hands-on release, but it's really teaching somebody what to do to set themselves up for success, what to maybe limit or avoid for a period of time, and sort of guide that timeline, right? And I think we generally always want to see people get back to the things they want to get back to. And there are times like when you had that experience with your multiple ACL tears where it was sort of like, it's time for a conversation. Let's think about pros and cons, but ultimately it is your choice. But we do really try to guide, so it is, there's a lot of the sort of fear mongering sometimes on social media. It's either, yeah, don't worry about it. If you feel good at 3 weeks, you can run, or don't ever do planks. Don't ever do whatever. And there's a happy middle ground, and it depends.
Right. That's the hard part, is it depends. And so we can't give broad-based education. Say, okay, everyone start running at 14 weeks and everyone start planking at 12 and it just doesn't work.
Yeah.
So unfortunately that leaves a lack of information, which gets filled in with some not so great information.
Yeah.
A lot of resources on my website, and hopefully I'll be updating soon to add a little beginner cheat sheet for new moms as to how to get back to something. So if you check it out, it might be there by the time if you're watching this.
That's right. Awesome. Thank you so much. It was great chatting with you.
So much. It was so great. You know me. I love to chat about all these things.
I know. I love this stuff. I'd love to get a whole bunch of us together and do like a panel sometime. Don't you think that would be fun?
I do think that would be fun.
You can find out more about Blair Evanosky at www.pregnancyandpostpartumpt.com, on Facebook at Pregnancy and Postpartum PT, and on Instagram at pregnancy_and_postpartum_PT. Thanks for listening.